Why is BMD testing essential for accurate FRAX scores? Imagine trying to predict the risk of a fracture without knowing how strong your bones are. That's where bone mineral density testing comes in. It gives a clear picture of how dense and strong your bones really are. This measurement is crucial because it helps doctors see how likely you are to break a bone in the future. The most common way to do this test is through a procedure called dual energy X-ray absorptiometry, or DXA. It's quick, painless, and involves a low dose of radiation. The test produces a T-score, which compares your bone density to that of a healthy young adult. A lower T-score means weaker bones and a higher chance of fractures. Now the FRAX tool is used to estimate the chance of breaking a bone over the next 10 years. It considers various factors like age, gender, history of fractures, and medication use. But here's the key point. FRAX can be used with or without BMD data. When BMD is included, it makes the risk estimate much more accurate. This is because BMD directly measures bone strength, which is a major factor in fracture risk. Without BMD, the risk estimate relies only on clinical factors, which can sometimes miss subtle differences in bone health. Research shows that adding BMD to FRAX improves its ability to predict fractures. For example, many people with osteopenia, which is moderately low bone density, still experience fractures. This highlights that clinical risk factors alone might not tell the full story. Including BMD helps identify those at higher risk who might otherwise be overlooked. It also helps in cases where risk factors seem low but bone strength is actually compromised, like in some older adults with diabetes who have higher BMD but still face increased fracture risk. In clinical practice, BMD testing supports better decision-making. It provides objective data that, combined with FRAX, helps doctors decide whether a patient needs treatment for osteoporosis. It also prevents unnecessary treatment for those at low risk. Overall, BMD testing makes the fracture risk assessment more precise and personalized. It helps ensure that those who need intervention get it, and those who don't are spared unnecessary medication. In summary, BMD testing is essential for accurate FRAX scores because it offers a direct, measurable insight into bone strength. It improves the prediction of fracture risk, especially in borderline cases, and helps tailor treatment plans to each individual. Combining BMD results with clinical risk factors in the FRAX tool provides the most reliable way to assess and manage osteoporosis risk, aligning with current best practices in bone health care. Always remember to consult healthcare professionals for personalized advice and testing options.